Ever wondered how medical professionals quickly assess a patient's condition? It's all thanks to medical acronyms. These handy tools are essentially linguistic shortcuts, allowing healthcare providers to quickly gather, share, and understand information about a patient's health. From the rapid assessment of trauma patients to the detailed examination of medical histories, acronyms play an indispensable role in healthcare. They are efficient, universal, and incredibly versatile, making them a staple in the medical field. Whether you're a seasoned practitioner or a medical student, mastering these acronyms can significantly enhance your diagnostic and communication skills. In this video, we'll journey through the most common to the rarely used medical acronyms. We'll break them down and explain their meanings, all to help you better understand and remember them. So, ready to boost your medical knowledge and perhaps even your medical vocabulary? Let's dive into the world of medical acronyms and decode their meanings. Kicking off our list, we have the acronyms SAMPLE, ASHIS, and OPIAST. Let's start with SAMPLE. It stands for symptoms, allergies, medications, past medical history, last meal, and events leading up to the illness or injury. It's a mnemonic that assists in obtaining a patient's history during the assessment phase. For instance, if someone came in with a sudden stomachache, a healthcare professional might ask about their symptoms, any allergies they might have, the medications they are on, their past medical history, their last meal, and the events leading up to the onset of the pain. Next, we have ASHIS. This acronym stands for age, sex, history, injuries or illness, current condition, and ETA or estimated time of arrival. It's often used in emergency situations to provide a quick snapshot of the patient's condition. For example, if a paramedic is transporting a patient to the hospital, they might radio ahead with the patient's age, sex, medical history, current injuries or illness, current condition, and ETA. Then we have OPQ or ST. This acronym is used to assess a patient's pain or discomfort. It stands for onset, provocation or palliation, quality, region or radiation, severity, and timing. For example, when a patient complains of a headache, a healthcare professional might ask when the pain started, onset, what triggers or soothes it, provocation or palliation, how the patient would describe the pain, quality, where the pain is located or if it spreads anywhere, region or radiation, how severe the pain is on a scale of 1 to 10, severity, and if the pain is constant or intermittent, timing. Remember, these acronyms provide a quick and efficient way for healthcare professionals to assess a patient's condition. They offer a structured approach to gather crucial information, ensuring nothing important is overlooked. So the next time you come across these acronyms, you'll know they're more than just jumbled letters. They're essential tools in the world of healthcare, helping professionals to deliver the best possible care. Moving on, we have acronyms like AVPU, SOAP, and ABCDE. Let's start with AVPU, a method to assess a patient's level of consciousness. It stands for alert, verbal, pain, unresponsive. This simple yet effective tool helps healthcare professionals quickly determine a patient's state and guide the next steps in care. Next, we have SOAP, a method of documentation employed by healthcare providers. The acronym stands for Subjective, Objective, Assessment, Plan. During a patient's visit, healthcare providers use SOAP to record the patient's complaints, subjective, the facts gathered during the examination, objective, the professional interpretation of these facts, assessment, and the proposed treatment plan, plan. This method ensures a comprehensive and systematic approach to patient care. Finally, we have ABCD, a vital acronym used in trauma and medical emergencies. It stands for airway, breathing, circulation, disability, exposure. The ABCDE approach is a systematic method for assessing and treating critically ill patients. It allows healthcare professionals to prioritize interventions and ensure the patient's most life-threatening problems are managed first. But acronyms aren't just about the big life-saving stuff. They're also about the small everyday information that helps build a clear picture of a patient's health. Take PEARL, for example. It stands for pupils equal and round, reactive to light. This simple acronym helps health professionals quickly assess a patient's eye response, an essential part of neurological assessment. Or consider RICE, which stands for rest, ice, compression, elevation. It's a memorable way to remember the initial treatment for sprains and strains, a common occurrence in our day-to-day lives. These lesser-known acronyms each play a vital role in patient care, and understanding them is key to navigating the healthcare field. They provide a systematic and efficient way to gather, record, and interpret patient information, ensuring each patient gets the care they need. While these acronyms may not be as widely known, they are still crucial tools in a healthcare professional's arsenal. Scene script. Lastly, we have acronyms like PEARL, PQRST, and RICE. Diving right in, PEARL stands for pupils equal and round, reactive to light. This is a quick and effective method to assess a patient's eye response, particularly important in cases of potential neurological damage or drug intoxication. Next, we have PQRST, and no, we're not talking about the alphabet. This acronym is used to assess pain. It stands for provokes, quality, radiates, severity, and time. It gives healthcare providers a comprehensive understanding of the patient's pain, from what triggers it to its nature, location, intensity, and duration. Lastly, we have RICE, which might make you think of dinner, but in the medical world it's a principle for treating sprains and strains. Rest, ice, compression, and elevation are the 4 key steps to minimize swelling and speed up recovery. These acronyms, while not as frequently used as others we have discussed, play a crucial role in patient care. They are simple yet effective tools that medical professionals use to assess and manage a patient's condition. They provide a systematic approach to patient care, ensuring nothing is overlooked. Remember, these acronyms aren't just jargon, they're important tools in the medical toolkit. They help healthcare professionals deliver the best possible care to their patients, and they can help you too, whether you're studying for a medical exam or simply trying to understand the medical world a little better. Despite being rarely used, these acronyms provide valuable insights into a patient's condition. There you have it, a comprehensive guide to medical acronyms. We've journeyed through commonly to rarely used acronyms, each one a vital tool in the healthcare field. Whether assessing a patient's condition or documenting care, these acronyms are the language of medicine. They streamline communication, enhance accuracy, and ultimately save lives. If you found this video helpful, please give it a thumbs up, subscribe, and leave a comment with any requests for future medical video topics. Thank you for watching.